Hi, this is Dr. Michael Horwitz bringing you another episode of Podiatry Help Desk. This episode is very special to me because it is the fungal nail episode, the first of a series of 5 videos that are listed as playlists in our YouTube channel. These videos are going to provide content that I hope will give you insights to how to treat your fungal nails. So in our first video, we're going to take a look at some nails, but before we do that, I want to give you a little background so you can at least get an idea as to why this is so interesting to me. If you've seen my other videos, you know that I am in love with the idea of making feet pretty or cosmetic surgery, and you've seen my before and afters. It's those before and afters that should give you the insight as to why I like treating fungal nails, because oftentimes my patients who've had great before and after pictures taken and great reconstructive surgery of the forefoot and rear foot, they've been left with feet that look beautiful with nails that look terrible. And it wasn't tolerable to me to have patients walking around with pretty toes, pretty feet, and nails that were absolutely disgusting. And they often come in packages. So I had to take it upon myself to figure out cures for these patients that had these problems and offer these cures. I also want to give you a little background into what I did in the past 7 years in St. Louis, Missouri to help support these efforts, because I knew that just giving somebody a bottle of antifungal wasn't going to be the answer. So I created something called CleanSpa, which I believe is one of the cleanest manicure pedicure facilities in North America, and possibly the world. CleanSpa, you can find out a little bit more about it online, is a trademark for a manicure pedicure facility that is absolutely clean for so many reasons. And in this video series, I'm going to talk to you a little bit about why our manicure and pedicure is so much better when it comes to being clean and preventing fungal nails. And of course, at CleanSpa, we've had the privilege of seeing literally thousands of people with fungal nails. And you might say, well, that's gross, but it's actually incredibly rewarding because we're able to cure these people. You can watch what we do and see testimonials and videos online, so you get a real understanding of how great it is to do something that is as close to perfection as I've ever come when it comes to building out a brick and mortar place for people to go get safe treatment. And we know pedicure's relaxing, but the truth is it's not very relaxing when you're worried about acquiring fungal nail infections or somebody damaging your toenails as they're being clipped. Let's get into what fungal nails look like and what some of the differentials are when it comes to diagnosing fungal nails. Now, the first nail shows just what I would consider to be a mild case of mycosis or dermatophyte infection of the nail. Now, there may even be more mild cases than this. You might have one that just shows a little bit of fungus, but when you start to see whiteness here and the signs that the nail is changing, usually more toward the tip of the nail, this is usually because the nail is being interrupted in some way, shape, or form, either by the shoe not fitting properly or some trauma or exposure to a moist, warm environment that has actually created this. And of course, bad pedicure can cause this, and I'll explain why in a little bit. So let's take a look at a few other nails that are definitely showing signs of mild fungus. Here's another one. Finally, here's a few more. And each time I click on one, I'll point with my arrow as to where obviously the fungus is occurring and the differences in these nails. This nail shows a corner of the great toe that's almost passing into the moderate range when it comes to dermatophyte infections, but also look at the bleeding under the nail. This usually goes hand in hand in the discoloration or blotchy appearance of the nail bed through the nail itself. So now we're going to show you a picture of what I would consider a more moderate nail infection. And here we can see that the nail is crumbling. Now that's usually what happens. You get to the point where you get thickness and crumbling of the nail, and this is the point where the nail starts to absorb water in the bath or shower and retain water throughout the day. Really, there's not much you can do when you get to this point because the nails get thick enough to act like a sponge and absorb water, which actually causes the infection to spread worse. Here's an infection that probably started as a very small part of the nail and has now spread to over half the nail. And finally, I think this picture tells a great story because looking at the nail right into the tuft of the great toe, you can see how thick this is. You can see how sponge-like it is and why water would simply get absorbed into the nail. You can also see that when the nail gets thick like this, it gets thick into the borders of the nail bed and nail plate itself, meaning that it often becomes hidden. And even if you did the best debridement you could on this nail, you can't get out all of the diseased nail unless you actually attack the borders. That's going to be something we're going to talk about also. But let's just take a look at a few more nails. Surprisingly, these are not old patients, as you might think. These are young patients that come in with this problem. You know, the degree of apathy that they must have to live with this is staggering because, or they just don't simply know any better and they don't know what they can do. This is what I call a severe fungal nail. It's gotten to the point where it's green, meaning there is most likely Pseudomonas in the nail plate itself. That's a bacteria, as well as Dermatophyte infection and possibly even yeast. All these can occur at the same time. If you don't think kids get this, here's a 12-year-old girl I just saw in my office, a 13-year-old boy. We'll be showing his case in a later video, but this is a 12-year-old girl that had this problem on a single toenail. And finally, there's extreme neglect. Nobody likes to look at these, but this is an elderly patient that came in with nails that are thick. And, you know, this is obviously not the Guinness Book of World Records when it comes to thick nails, but it really shows that this is more like neglect than it is anything. This is a complete lack of paying attention to your feet at this point. And I'd like to explain in later videos, and we'll explain how we treat this so you get a understanding of what we do. The next picture is special to me because this picture shows the foot of a 20-year-old female that came into me early in my career, and I was privileged enough to treat her. If you look closely, the nails on the before picture are accompanied by a bunion deformity and hammer toe deformities. She came into me with a mouthful of crooked teeth, hair that was matted, glasses, acne, and really no self-esteem. And the reason I'm telling you this is because not only does the picture on the right represent her after picture, obviously, but it represents what her entire beingness and body looked like 1 year after treatment. In other words, after we did her foot surgery and we fixed her nails using special procedures, she came back with straight teeth, no acne, beautiful hair, and an outgoing personality, no glasses. She was a completely different person. And that, I think, was what I needed early in my career to fuel my desire to go in the direction of wanting to make people feel better and thinking like a plastic surgeon in terms of changing cosmetic appearances. It was remarkable, the change that occurred in her, and I'm really proud to say that she's doing well, and that I was able to participate in her decision to start changing herself for the better. If you click on the link below or you click on the link right up here, you can schedule a consultation with me. It's as simple as emailing me your desire to have a personal consultation, assembling any records you may have or x-rays, getting them into my possession through email, and finally doing a Skype presentation of your foot to me. Over a period of maybe 20 or 30 minutes, I can get a good idea of what's going on with your foot and give you the benefit of 30 years of professional expertise. Until then, this is Dr. Michael Horwitz with the Podiatry Help Desk. bringing you another episode of Controlling Your Fungus with Value-Based Approaches. If you like this video, please give us a thumbs up. And if you subscribe to my channel, I promise you'll get more great information about our podiatry services that will help you better understand the subject of podiatry and how you can be helped. Thank you.